For that, I'm going to introduce Wayne Carter, who, as you know, is the president of KCALSI, who will discuss our strategic assessment results in more detail. Before I return the mic over to Wayne, I want to acknowledge Wayne and his leadership. He's making a real difference in our region and has brought his unique combination of talents as a scientist, a business person, and civic leader to advance life sciences in our region. We're very lucky to have Wayne here.
Thank you, Bill.
All yours.
Well, it's really a pleasure to be able to discuss with you and present the results that were so rigorously developed by Deloitte. In front of you, you see a map of the of the world. In front of this map, you have life science clusters that are listed in blue. Those are established life science clusters. And you have life science clusters that are in green. These are aspiring life science clusters. In Kansas City, it's important to appreciate that we have a 3-to-1 ratio of the number of human health R&D assets to animal health R&D assets. And yet on this map, we're listed for animal health and agritechnology. Why? Because we have the greatest concentration of animal health assets in the world. So we need to leverage that strength and figure out how we can develop a strategy around that strength to continue to grow our cluster. One of the findings from Deloitte as they looked at other clusters is they recognized that clusters that work holistically, not just in the life sciences, but in convergent and adjacent technologies, are really poised to win in tomorrow's market. They also identified that clusters that create pull models. So these are models where you attract entrepreneurs and investors to a region because of the assets, the resources, the culture that you have, especially valuable if you have unique assets in a particular region. So are we creating a pull model in Kansas City? To answer that, Deloitte identified 8 different drivers of cluster enhancement. Again, as Bill mentioned, this was unique. This was not done 10 years ago. And as you'll go through tonight, you'll hear about, as I'll go through tonight, you'll hear about these drivers of cluster enhancement. This is some of the research that they developed. And you can see for each of these drivers, now there's a color code which represents the strength, weakness, opportunity, or threat for that particular driver across our region. I don't have time to go into all of these in detail. I, again, encourage you to read the report. It's very rich, and there's a lot of great detail in it, but I will focus in a few different specific areas. In workforce development, you can see it's listed not only as a weakness, but a threat. This is a chart which shows the National Assessment of Education progress, and as you can see through 8th grade, we are on par, or actually above par, in Kansas and Missouri in 8th grade math and science scores. That's obviously good. It's not necessarily good to be average, but at least we are average and above par. And especially you have to think about, well, so the United States, obviously there are many countries that are eating our lunch. And so again, it's not necessarily good to be average, but at least we are average through 8th grade. The concern becomes when you look at college preparedness. So for high school seniors, in Kansas and Missouri, we literally have 2% of our high school seniors that are taking the AP Bio exam in comparison to 5% nationally. For AP Calc scores, in Kansas, we have 4% that are scoring a 3 or better in the AP Calc exam, 3% in Missouri, compared to 7% nationally. We simply cannot create a STEM-based ecosystem with these kind of workforce development numbers. So this obviously is a crucial area of concentration for us. In investment, in capital formation, again, you can see we have weakness in this area. This is a quote from one of the interviewees. The biggest gap is follow-on funding. We tend to see entrepreneurs who have maximized their angel networks, and we need to do something as a region if we're serious about keeping these companies. So is our region a pull region, or is it a push region? Are we actually pushing away our entrepreneurs and our companies because we don't have the adequate funding that we need to keep them here in the region? This is a chart which shows venture capital investment, and it's normalized by states. The states which are highlighted there are life science cluster states, and as you can see, there are two bright shining stars. They, not surprisingly, are California and Massachusetts. You can see the venture capital investment that they're getting, about $6 to $7 per $1,000 of state GDP. If you then look at Kansas and Missouri, we're getting about 38 cents in Kansas and 31 cents in Missouri per $1,000 of state GDP. Again, we have a significant problem if we want to develop our cluster. SBIR funding and STTR funding are great ways for us to use NIH dollars and move technology out of the universities and get them into a commercialization realm. Are we leveraging them? Are we using them? The answer is no. Again, we're at the bottom of the list when it comes to SBIR and STTR funding. So there are some significant things that we can do to obviously move our region forward, and we're going to be working obviously in several of these areas. We definitely have some areas of strength. Obviously, one of the most significant ones, as you can see here, is entrepreneurship. To a large degree, it's thanks to the expertise, the world-class leaders that exist at Kauffman and lead our entrepreneurial efforts, not only in the Kansas City area, but obviously across the nation and the globe. We also have other entrepreneurial assets across the region that work to help different entrepreneurs as they're developing companies. We also have an opportunity, and that opportunity is to make sure that we have the entrepreneurial skills and assets available for life science companies, and as you hear me talk about in a few minutes, health IT companies. This is a chart which shows the density of high-tech companies, startup companies in the Kansas City area. Again, you can see in this case, we're ahead of the curve. We have some strength there, and as I talked about, identifying adjacent and convergent technologies that can help life science companies and consider new business models. This is a great way in which we can leverage some of those assets across our region. We also have significant strength when it comes to networks and collaboration. We're already recognized for our strength, but we're also separated by 300 miles across our region from Manhattan, Kansas to Columbia, Missouri. So we have to figure out ways in which we can reduce that physical space, identify ways through new collaboration tools to physically and virtually reduce that space. Again, there's opportunity, especially as we think about how can we build out this region. We've got to figure out how to work functionally as a region and not individually. We need to move from an institutional perspective to a regional perspective. The future lies in a framework for institutions to work together to compete with other regions for resources. So where are we collaboratively? I oftentimes at our annual dinner, I talk about some of the successes we've had in collaboration. It is a strength, and we have had successes. This year, Children's Mercy and KUMC identified a strategic partnership specifically focusing on improving health for children, a great partnership. Our three deans of the med schools in Kansas City, KCU, UMKC, and KCU, are not only talking cooperation, they're listening and they're acting on it. They've listened to Linda Bonewald, a scientist who brought together a group of other scientists and said, we want to work and develop a consortium in the area of neuromuscular disease and muscle-bone crosstalk, and that's exactly what now has been established, a consortium for the first of its kind in this region and probably in the entire nation, where you've got 3 medical schools working together collaboratively around a particular area. We also need to build symbiotic relationships with industry. Again, we've got some good examples here. This past year, relationships were established between UMKC and Truman Medical Center and Cerner, and also the University of Missouri and Cerner. We've got some, we need a lot more. Obviously, you're familiar with NBAF, the National Bio and Agri-Defense Facility. Called out in this report was an opportunity to build an ecosystem around NBAF. Tonight, I'm pleased to announce, and actually in our audience we have Marty Veneer and Jamie Johnson. Jamie is the executive director from DHS for NBAF, the NBAF facility. And just today, they announced an award, $100,000 award, specifically to find the best solutions to promote and stimulate collaboration, innovation, and talent development all to help build out the NBAF facility. I think that deserves a round of applause. We decided also to focus in scientific areas as we did 10 years ago. Those scientific areas are listed here. There are 7 different scientific areas, and on the right-hand side, you'll see a relative competitive advantage potential. These pie charts represents that relative potential. As you can see, animal health and health IT are completely colored in. They're absolute strengths. We are the animal health corridor, and we have tremendous assets when it comes to the health IT space. These are just some of the assets. This is not just Cerner, it's DST, it's NetSmart, it's many small and medium-sized companies, it's entrepreneurial networks like Google Fiber, like KC Digital Drive, Sprint Accelerator. We've got our health networks. We've got tremendous assets in our academic institutions in the health IT space. So this is a great opportunity for us to build this ecosystem. And that's exactly what Deloitte called out in the report. It's an opportunity for us to build this ecosystem. Think back 10 years ago, think back to where we were with the animal health industry. We were thinking about developing an ecosystem around the animal health industry. Today it's now known as the animal health corridor. This is an opportunity for us to capture the strength that we have and to build it into an ecosystem just as we have the animal health corridor. The other reason why it becomes a great opportunity for us is because there's a synergistic opportunity with outcomes research. Outcomes research is a very much developing area funded to a large degree because of PCORI, the Patient-Centered Outcomes Research Institute. We have some of the best leaders, world-class leaders across this area. It started with John Spertus and David Cohen at St. Luke's. It has spread across this whole region. We now have PCORI grants at KU, KUMC, UMKC, Children's Mercy, University of Missouri. So we're all leveraging these opportunities across this region, and it is an opportunity of great strength for us. We can't do everything, though. We'd like to, but we always have to provide focus. So where are we going to focus? Scientifically, we've decided to focus in 4 different areas. You can see here we've actually combined health IT and outcomes research together, as I've already described. Animal health, we know, is already a significant strength across this region. We'll continue to focus in animal health, figure out how we can make it even bigger and better into the future. Cancer research and care was identified 10 years ago. 10 years ago, Roy Jensen was hired by KU to lead the development of the Cancer Center. There was tremendous community support that came around the support of the Cancer Center. In 2012, KU received NCI designation for the KU Cancer Center. There's already a significant regional involvement in the KU Cancer Center, which is great. But we also see great opportunity. The University of Missouri has the nation's largest research reactor. Every day they're developing radiopharmaceutics, radiodiagnostics, radiotherapeutics that are used in people every single day. It's not an asset that we're very well leveraging across our region. So we need to figure out those assets and all of the assets that specifically fit into the cancer research and care and make sure that we're truly working across this entire region. Whoops, I skipped one, I'm gonna go back. Neuroscience is the 4th area. We have great strength, nationally recognized strength in stroke with St. Luke's, in stroke with KU, in Alzheimer's disease with KUMC. And so these are great strengths for us. But again, we can't do everything in neuroscience. We need to figure out where we're going to focus. Is it ALS, where we're doing a lot of research, or is it autism, where we're doing a tremendous amount of research, KU, MU, Children's Mercy. So we need to figure out where we're going to focus and then move forward with specific plans. In the cross-cutting drivers of cluster enhancement, we're going to focus in 4 areas. Obviously, workforce development, where we're partnering with KC Rising. Investment, there are many different groups across the region that are focusing on this. We recognize this problem, and we're going to find solutions to it. Collaboration, it's a strength, but it is also an opportunity. We know we need to work better together as a region. We're stronger as a region, and so we have to figure out ways in which we can improve collaboration. And then the fourth one is messaging and marketing. When you put the whole thing together, it looks like this. We've got the scientific areas on the top, the cross-cutting capabilities on the bottom, and at the center is a vision statement that reads, the Kansas City region is a global leader at the nexus of human and animal health, benefiting all of our citizens and the economy. So I'm going to speak on a few words here just for a minute. So the nexus, what is that? So there are great opportunities for us to leverage our strength on the animal side to help the human side, and the human side to help the animal side. We've existed in silos for too many years. We know that there is an opportunity, and the opportunity is already right in front of us. Companies like Aratana, they're using human drugs to develop them specifically for animals. Stowers, their lead compound is actually a cancer drug for dogs. We've got great orthopedic expertise at the University of Missouri, Jimmy Cook. Jimmy is an orthopedic surgeon, but he's actually now in charge of the research at the human hospital. So we've got great opportunities where we're beginning to leverage this. We need to develop and build this out and explode this, if you will, exponentially for the entire region. Benefiting all of our citizens. Leo Morton, I've got to call out a specific recognition. He really pushed us on this as a steering committee. He said, we've got to make sure as a community that we're reducing healthcare disparities. And so benefiting all of our citizens is specifically that reach out to say, as we develop this, as we develop our strategy and look forward, we've got to figure out how we can reduce healthcare disparities. And obviously, we all know the significant impact the life sciences can have in the economy. So our next steps, we're already moving down this path. We're identifying a vision for each of these working groups and scientific areas, establishing 3, 5, 10-year objectives, developing, supporting milestones, metrics, looking and obviously looking for particular funding recommendations that come from each of these groups, and asking each of the groups to consider this human-animal nexus, to consider precision medicine, genomics, wearables, artificial intelligence, to look at the regional strength in drug development, our strength in pediatrics, and across the entire area to think about how we can integrate health IT into the entire space. We're ultimately looking to develop a dashboard, a way in which we can monitor progress in real time to make sure that we are moving the region forward. So we don't have to wait for another 10 years and say, how did we do? But we can actually look on a real-time basis to see how we're doing. What do I see? I see opportunity. For those of you that have a scanner, you can scan that QR code and you can download the report on your phone right now. Certainly you can go to our website tomorrow or at your convenience to download the report. I see opportunity. I see opportunity that exists across this nexus of human and animal medicine. I see opportunities in the health IT space. I see opportunities to grow an ecosystem in health IT, just as we've grown an ecosystem around the animal health corridor. But we've got to create a pull model. As I talked about, we've got some significant challenges when it comes to workforce development and capital formation. We have to create a pull model to make sure that those opportunities can come to life. So that wraps up my piece of the path to 2025. I'm not quite done yet. I do want to follow up with just a few last comments about things that we talk about every year, and one of which is a recognition of our grant recipients. We give out grants, research grants, to recipients around the region because of very generous support that we get from Blue Cross Blue Shield and the Patton Family Trust, Paul Patton Trust. So for Blue Cross Blue Shield, there's a number up there. That number actually is not the number of minutes I have left, but that actually is our ROI, return on investment. So for every dollar that goes into these programs, these research grants, the researchers that do such a great job, they're getting $8.50 of follow-on return dollars back to the community from other funding agencies. And so there's a very significant multiplicative effect here, almost exponential, Salim, although not quite. who would like to have an 8.5 to 1 ROI on their 401k? Yeah. So, in the, again, I'd like to acknowledge the recipients for the outcomes research. 4 recipients this year, focusing on everything from chronic care management for older patients to decreasing barriers to weight loss in adults. With the Paul Patton Trust, these are focused on childhood genetic diseases. We have 3 recipients this past year, and they are listed here, again, focusing on different diseases that affect our children. And then tonight, I'm also really pleased to announce a brand new grant funding mechanism. We just received a notice a few days ago from the Bank of America as the trustee for the Victor Spies Foundation. We now have funding to support neuromuscular research. And so the consortium, which has been identified, thank you, yep. So the consortium, which is developed around neuromuscular disease, we now have a funding mechanism to support that great research. As I wrap up, I have to thank all of our many strategic partners. I'm not going to list all of them. They're up here on the slide. They all serve a key role in this community, and I certainly ask that you continue to support them. They're great partners in what we do, and they're very significant supporters of what we do. And I absolutely have to thank our stakeholders. They're helping to sponsor the dinner tonight, and they support us in a very significant way throughout the year. They enable us to carry out a strategic assessment like we've done with the additional funding we had from other agencies, but they allow us to create so many different programs, and we're really appreciative of their support. And I'd like to thank, again, just an applause for the researchers in the audience and our stakeholders, and obviously all of you for attending. Thank you.